Lindsay, thank you. All right, 8:30 on this Wednesday. As always, we're joined by Dr. Syed Hussain from Trinity Health of New England to talk about some of the stories that a lot of you are learning about and talking about. And there are a couple eye-openers today. Good morning to you. Good to see you again. First of all, we want to talk about a new weight loss drug designed to lower the body mass index in children as young as 6. Open my eyes for a second. First of all, what is the drug? And I know a lot of people understand Ozempic now. Is it kind of like Ozempic?
Yeah, it is similar to Ozempic. It's an older drug, Tim, that was studied in children age 6 to 11. It's called liraglutide, very similar to semaglutide, which is in Ozempic. So it is a GLP-1 drug. And what happened here was the study looked at about 82 children, ages 6 to 11, with a BMI of 31 or higher. Yeah. And half of those children got placebo, half of them got the drug. Were followed for 56 weeks. That's a little over a year. And there was reduction in BMI. BMI is a better indicator rather than just weight that we look in adults, because remember, these children are growing, right? So BMI takes into account height and weight. Okay. So it did show some good promise. Now, here are the questions that this whole drug and this trial brings up is, remember, the premise of this drug is it's going to combat hunger, right? Children are not going to be eating. That's the premise of this drug. That's how it works, and that leads to weight loss ultimately. And so what impact will this have on children that are growing? Remember, this is a crucial age for development. So will it lead to puberty that's delayed? Will it cause delayed growth, development? Will it have impact later on in life on other organ systems such as the thyroid or pancreas? What is the impact on bone health? So we don't have long-term studies on this. So, there's a lot of conversation, discussion that needs to take place. The American Academy of Pediatrics last year actually for the first time recommended in children above the age of 12, in addition to lifestyle modification and diet, exercise, that they may be candidates for weight loss drugs.
That's 12 and up.
12 and up. Yeah. Not below 12. But it warrants the question, do we target those that have a higher BMI, for instance, that we know the trajectory would look bad? They will develop comorbidities very early on in life, such as 35 and above. Right. So all things that need to be taken into account.
Yeah. So basically what you're saying is whether or not the drug works might be secondary to whether it's optimal or even appropriate when you're looking at a 6-year-old, where maybe lifestyle modifications might be the better thing. All right, another thing that people are talking about, a study that found that the pandemic may have affected teens' brains, sort of suggesting that they aged their brains. What do they mean by that?
Yeah, so there are a lot of studies out there that show how the pandemic impacted mental health, Tim, and we've discussed it in the past on this segment. Now, this study looked at brains for 160 teenagers, measured the thickness of the cortex, cerebral cortex. That's the outer layer of the brain, the tissue that is responsible for higher decision level, more enhanced functioning of the brain that takes place. Right. And so there was another follow-up MRI that was done in 2021, 1 year after the pandemic started. So all those lockdowns and restrictions that went into effect. And there was increased thinning. So the brain cortex thins as we grow older. But there was enhanced thinning 4.5 times more in girls, 1.5 times more in boys.
Do they know, was it because of viral infection? Was it the lockdowns and the isolation?
So
was it
all of those correlations weren't studied, Tim, but remember, this was a time when there needs to be social interaction and during the teenage years. It's critical, right? And all of that was put on pause. Yes. We had lockdowns, restrictions on how you can meet. And we also saw a concomitant increase in mental health issues.
Of course. And now the question, and I know this can't be easily answered, especially because we're out of time, is it reversible? Can you bring any of that back?
Great question. That's what researchers need to study more. Will it lead to decreased rate of cortical thinning?
Yes. All right, doctor, thank you. I know there's a lot of technical stuff we had to get into.
Thanks much.
Whenever we're talking about cortical thinning, Erica, we're going to leave it to the experts, right?